transparently, including the wealthiest of New Yorkers finally paying their share. It will eradicate healthcare disparities among blacks and Latinos who currently suffer disproportionately under a system that is fundamentally unequal and, quite frankly, institutionally racist. Mark my words, healthcare is one of the great civil and human rights issues of this era. Therefore, we want everyone in this room at Caucus Weekend to be involved in the campaign for New York Health. So please sign our petition, pick up a packet of materials, and get active in this tremendously important cause. Thank you very much.
So did Senator Perkins spark you to join us in this marathon?
Yeah!
Now, I would think that will allow us that you'll be more curious and excited to know a little bit more details about the New York Health. So I want to bring up Assemblyman Dick Gottfried.
Well, thank you, Tony, and thank you all for joining us here this morning. You know, every issue that we face in healthcare, whether as patients or healthcare providers or employers or taxpayers, is made worse and made harder to solve because of how we pay for healthcare in this country. The Affordable Care Act made some enormously important improvements. It's made a lot of difference, including here in New York, where we had already enacted some important reforms. But it all leaves insurance companies in charge. And what that means is rising premiums. It means out of control deductibles and copays. And deductibles mean that sometimes the insurance that you've bought you don't even get to use because you can't afford to spend for the deductible. It means restricted networks of providers and what drugs your health plan will cover. And if you dare to go out of that network, you are paying out of pocket. So you've got restricted networks and out-of-network charges. All of these things are real obstacles to our families getting the health care that they're entitled to, and they are real obstacles to family financial stability. And increasingly, we have employers shifting more and more of the cost of health coverage to workers, or dropping coverage entirely and just saying to workers, you know, go buy coverage on the exchange. Even for people who are on publicly funded coverage like Medicaid and Child Health Plus and the new Essential Plan that is just now starting to roll out, all of those plans involve a managed care company with its restricted network, with its restricted formularies. And so even people who are lucky enough to be receiving publicly funded health coverage have a lot of the problems that come with insurance companies. And what we spend for that coverage, much less of it goes for health care, because so much of it goes to pay for insurance company executives and administrative costs, and in some cases profits, and for the administrative costs that healthcare providers have to spend in order to fight with insurance companies. All of that fighting back and forth ends up taking about 20 to 30% out of the healthcare dollar. It doesn't benefit any of us, it benefits the insurance companies. You know, a third of families who have health insurance reported that at least one member of the household in the past year went without health care because of financial reasons, and in 2/3 of the cases it was for a serious condition. 35% of households with insurance report having had difficulty paying for needed medications. The way we pay for health care is a major contributor to inequality in our society, because health care is about 1/5 of our economy. It's necessary. It's not like you can go without it, or if you do, it could kill you, certainly cripple your ability to earn a living. It's expensive. And most of us have to bear that cost without regard to ability to pay. So the premium that George Soros or Michael Bloomberg pays for health coverage, or the deductibles that those guys are expected to pay, are exactly dollar for dollar the same premiums and deductibles and copays that the janitor or the receptionist in their office is expected, what the insurance company wants. You know, we held hearings around the state, and we heard time and again about the real financial barriers to health care that people in New York face, how it devastates their health and their economic well-being. We heard from doctors talking about how they can't practice medicine the way they learned to do it in medical school because of how much time they have to spend fighting with insurance companies, and because what insurance companies won't let them do. We heard from small business owners who want to be providing health coverage for their workers but can't afford it because of what insurance companies charge. And by the way, they charge small businesses more than they charge big businesses. Or companies who say, you know, they're losing good employees because they go off to work for large companies that provide health coverage. These stories have been, you know, for me it was very difficult to listen to those stories, but what they show us is that New York as a community and as a family has to do better, and fortunately we can do better. And that's where we come to the New York Health Act, the bill that Senator Perkins and I are sponsoring. It would set up in New York a universal health coverage plan that would cover every New Yorker, and I mean every New Yorker, whenever they got here, however they got here, rich and poor alike, every New Yorker would be covered. It would be better coverage than any of us have, because there would be you would not have an insurance company telling you what doctor you could go to, what drugs they would agree to cover. It would be better because there would be zero financial barriers to care, no deductibles, no copays, and it would be paid for more fairly through broad-based premiums that everyone would be contributing to based on ability to pay. So low-income New Yorkers would not be paying that premium. As income goes up, people would be paying that premium, and it would rise as a percentage of your income as your income goes up, as it should be. I mean, George Soros, bless his heart, good man, a lot more of his income ought to go to pay for health care than my income or your income. You know, the dollar that puts bread on the table should be taxed at a much lower rate than the dollar that puts caviar on the bread. I guess you put caviar on bread, I don't know. And I have tasted caviar, I really didn't like it, which is good, because I couldn't afford it anyway. So people ask, how is this possible? And it's possible in large part because we take insurance companies out of the picture. And that means that in New York, and we've had economists do a very detailed analysis of this, in New York we would save every year $71 billion. You're not used to hearing a number like that. $71 billion by eliminating insurance company administrative costs and profit, by dramatically cutting back on what healthcare providers have to spend on administrative costs, and by having one unified health plan negotiating with drug companies, not on behalf of a couple of 100,000 customers, but negotiating with real clout on behalf of 20 million customers, all of us here in New York. Now, in addition, apart from saving $71 billion, we'd have to spend more. We'd be spending about $26 billion because we'd be covering all the uninsured. We'd be paying Medicaid and Medicare providers at a higher rate of payment. And there would be no out-of-pocket costs, no deductibles, no copays, no out-of-network charges, because there would be no restricted network. When you balance off the $26 billion in increased spending against the $71 billion in savings, the net savings to New York every year would be $45 billion. which comes out to about a little over $2,000 for every man, woman, and child in New York. I think we can all think of some really good things that we would be able to do with an extra $2,200. It would mean equal opportunity for New Yorkers to have a healthier life and to have financial well-being for our families. It would remove barriers to health care and enable each of us to take control of our health care and take responsibility for our health care. Now, how do we pay for it? We pay for it through a broad-based premium. The most important thing is that we would no longer be paying through the regressive tax that we now pay to insurance companies in premiums and deductibles and copays and the like that have no relation to ability to pay. Instead, there would be a premium that would be assessed on both earned income, payroll, but also for the first time it would also be a premium based on taxable unearned income like deductibles and interest and capital gains and dividends and capital gains and interest, which is where the real wealth in our society is found. Paying for it fairly with ability to pay and reducing the cost by eliminating all those administrative costs is how we are able to say that in New York, 98% of households, which I'll bet is every household in this room, 98% of New York households would be spending less than we now spend on premiums and out-of-pocket costs. Now, an awful lot of people say, well, everybody knows single payer is the only sensible way to do it, but it could never happen. Well, that's changing, and it's our job to make sure it changes. With the Affordable Care Act being enacted, more and more people are now seeing that, yeah, marginal improvement helps, but if you really want to change the quality and access to healthcare in this country, you've got to get rid of insurance companies. And so there has been an enormous surge in labor support. The New York State Nurses Association is on board. Actually, they were on board with a single payer even before I was. They were one of the groups that helped sell me on the idea, and that was 25 years ago. And the New York State Nurses Association and 1199 and the New York State United Teachers are not only among the unions that have supported the bill, but they've each written a check for $25,000 for the campaign for New York Health. Not the campaign for me, that would have been nice, but no. Well, they couldn't give me that much money. But for the lobbying campaign for the New York Health Act, and there are other unions that have also kicked in, although not as generously as NYSNA and 1199 and NYSIT. My mother's union, and my mother-in-law's union, NYSIT. 32BJ is supporting the bill. The retail wholesale department store unions, the UFCW, CWA, UAW, the Working Families Party, the Green Party, New York Communities for Change, Make the Road, New York Immigration Coalition, and by the way, every single member of the Black, Puerto Rican, Hispanic, and Asian caucus in the Assembly, and I think probably almost in the Senate, are sponsors of the bill, and the caucus has endorsed the bill. The Assembly passed the bill last year. We're going to pass it again in a couple of months this year. We are changing the conversation from, oh, that's a nice idea, but it could never happen. People are beginning to believe and understand that this is something that really is achievable. And I believe that when people come to believe that this is achievable, that's going to put it on the road to being inevitable. Because the only people who would not support the bill, in my way of thinking, are people who either have a vested interest in protecting insurance companies, and there are some people like that, or who, for political reasons, are protecting the people who are protecting the insurance industry. And no, I'm not going to name names. It's a free country. We need to change that conversation. We need to make this happen, and we all together can do that. Thank you.
I know we're a little bit behind, but this is critically important. I want to introduce Bill Perkins again because he wanted to make an announcement.
Quick. I won't be long. Each of you are receiving something because we don't just want this to be a conversation. We are activists. We want to make something happen. So that what you are receiving is a petition to ensure healthcare is a human right. And it's a brief note to our dear Honorable Governor Andrew Cuomo. As a voter and a constituent, you wanted to express my urgent desire for your immediate support of the New York Senate Bill 3525 Assembly Bill 5062, sponsored by Senator Perkins and Assemblyman Gottfried. This legislation will once and for all enact universal single-payer health care in New York State. Furthermore, this proposal will ensure that patients are always placed before profits and each person can live by the maxim, quote, your health is your wealth. It will enact universal health coverage for all, universal benefits for all, move away from fees, bills, private greed towards a non-profit public model of care, usher in progressive taxation to fund the system, and costly Medicaid mandates of our counties, saving them billions of dollars, establish our state as the model in post-Obamacare healthcare policy, and eradicate health disparities among blacks and Latinos who currently suffer disproportionately under a healthcare system that is fundamentally unequal and, quite frankly, institutionally racist. As a long-time human rights advocate in the Empire State, dear Governor, I urge you to stand up for health of each and every New Yorker by working towards the prompt passage and progressive implementation of New York Health. Respectfully submitted. Each of one of you will receive this so that your name is on it on behalf of this movement as someone that understands the significance of what we're trying to do. So each of one of you will get at least one. If you want, my staff is in the back that will give you others so that you can get your family and colleagues to let the governor know that we want him on record in making sure this legislation is passed.
Thank you. I want to bring up Dr. Donna Moore. He earned his MD and MPH degree in 1981 from Yale School of Medicine. In 1988, he opened a full-time general medicine practice in Brooklyn to serve his community. And folks understand that in Brooklyn, particularly central Brooklyn, the crisis that occurred in that community, it may be hiding there, but it's across all our city and including the state, particularly our communities that are low income. He currently teaches at medical student for Weill Medical College, and he's a board member of Physicians for National Health Plan. Dr. Moore.
Good morning. I can't rile up this audience like Senator Perkins did, nor can I provide the level of details as Assemblyman Gottfried has, but I can give you a quote. Of all forms of inequality, injustice in healthcare is the most shocking and most inhumane. Dr. Martin Luther King. So he was quite prescient in seeing that way back then. This is a panel on disparities. It would seem after Obamacare that we would have eliminated a lot of disparities. But I'd like to take it from a different perspective. The disparities of healthcare in America is America. Because when you compare the health status of Americans to other developed countries, we are the worst. That is not just my opinion, that is a fact. America has the highest infant mortality, which is a measure of the quality of the healthcare system, in the developed world. Our life expectancy, how long you live from the time you're born, is about equivalent to the life expectancy in Cuba. Our maternal mortality is one of the highest. Women die giving birth, one of the highest in the developed world. But we spend twice as much as the country that spends the second highest amount. That's our neighbors to the north. I didn't really prepare a talk here, so with the risk of sounding incoherent and disorganized, I'm just going to ramble a little and then get off because I'm going to make up the time that Assemblyman Gottfried took and Senator Perkins took. Okay, so, you know, what do I know about disparities in healthcare? Of course, I'm a doctor. Well, what I know is I'm also an individual who needs healthcare, and most of my life I've never had health insurance. As a matter of fact, I just got health insurance this February. This is still February, right? I just got health insurance. I didn't have it last year, and I've had it on and off. And the reason why I didn't have it is most of the time I couldn't afford it, and it would seem the doctor can't afford health insurance. Most of the time I really couldn't afford it, and when I did have the money to sort of do it, it wasn't worth it. I'm really glad I got it just now because I need to see the doctor for personal reasons. I won't tell you all my business. But you're welcome. So, all right. So, you know, obviously, as you know, why don't I have health insurance? Well, one of the reasons why I don't have health insurance is because I treat people who pay me very little. Why do they pay me very little? Because the people that I treat get lousy health insurance. Do you believe Medicaid pays the doctor the same as other insurances? They don't. Do you think New York State pays me the same? You know, I'll give you an example. Medicare says, I make house calls. I've made house calls since the beginning of my practice. I wrote an article in Yale Medicine in 1990 something, 10,000 house calls and still counting. So I make a lot of house calls. Do you know what Medicare pays me for a house call? Well, about $110 to $140. Now, how can one make, a house call takes me an hour and 20 minutes. How can I make any money? So I subsidize house calls. In the office, it's the same thing. So, you know, doctors, some make a lot of money, and I think that's good for them, but most doctors that are treating people who are on the fringe of society make very little money doing that. We balance things, we transfer funds, and we do the best we can. Now, I could see a patient for 10 minutes for $110, or in the office, Medicaid patient pays $70, $80. I could see 5, 6 patients in the hour, but I can't treat people in 10 minutes or 8 minutes. So the point is, until we have a system that reimburses physicians, providers, hospitals. In where I practice, the hospitals are closing like that. You know, St. Mary's, Interfaith is on the quarter all the time. I thought, what was a hospital that just closed? Litch, right? I thought those hospitals were doing okay, but they're suffering because of what they are reimbursed. Most of my patients, they come in now, and they say they saw a doctor. Which doctor you see? They don't know which doctor they saw because they don't really have a doctor. They have a provider, they walk in, somebody goes and see them. That's not healthcare, and that's where the disparity is. It's in America. So how do we solve it? Well, maybe we should have the same reimbursement for healthcare for everybody. Maybe we should have a floor that we could all. He's standing here because it's time for me to go. I promised to yield my time. So I'm going to yield it at this point, but I want to point out that the disparity has not been solved by Obamacare. The disparity has been worsened. Because Obamacare, I did have insurance just before Obamacare. I lost it then because I wasn't low enough to get subsidies, but I was just above it where they made my insurance a lot more expensive to pay for the lower quality insurance. The rich guys, it doesn't matter. They're going to have insurance no matter what. No, you could raise up, they'll get it. But it's the middle class, it's those in the middle that suffer. Obamacare worsened that, even though it definitely helped the ones at the bottom. So we don't need a short gap solution to this. We need a comprehensive solution where everybody from Alaska all the way to Hawaii, and New York included, have the same insurance, an insurance that's going to pay the providers a livable reimbursement, wage, whatever, so that the services can be equalized so we can take care of the population. If you want to buy more insurance, you can do that. And hopefully when we have such a solution, then the doctor can get insurance and take care of himself, his family, and his patients. Thank you very much.
I hope when you hear everyone speak that we all look collectively how institutionalized this inequity is and how it streams across all of us. So another group of folks at profession that knows a lot about this as well is our nurses. And I see Naisna in the back because I see all the red. So I want to bring up Jalisa So. She worked at Elmer's Hospital Center as a registered nurse for over 10 years. She's currently at release time representative for NYSNA, New York State Nurses Association, and has served as a mentor on the clinical advisory board for Adelphi University, Heaven Full College of Nursing.
Good afternoon, everyone. On behalf of the 37,000 registered nurses and healthcare workers that I represent, I'd like to thank you for the opportunity to address you today. As many of my panelists have mentioned, comprehensive plan to address healthcare disparities is needed. So I'm going to talk to you today about safe staffing. As nurses, every day we see, can you hear me? Yes. As nurses, we see every day how this crisis hurts our patients. But hospital administrators are actively going against our safe staffing.